NCLEX RN Practice Exams. Subject: Physiological Integrity. Module: Basic Care and Comfort. Chapter: Part 2. A nurse is assisting the physician with a lumbar puncture on a patient suspected of having meningitis. During the procedure, the nurse notes the patient is experiencing cold, clammy skin, tachypnea, and an increased pulse rate. The nurse should: A. Continue monitoring the patient. B. Notify the physician. C. Administer an analgesic. D. Advise the patient to take deep breaths. The answer is B. Notify the physician. The physician must be notified because this is an abnormal reaction. Lumbar punctures place the patient at an increased risk of complications and adverse reactions. The lab results are now available for a nurse caring for a patient with Addison's disease. Which of the following results are unexpected in this patient? A. Hypokalemia. B. Hyponatremia. C. Hyperkalemia. D. Hypocalcemia. The answer is A. Hypokalemia. A patient with Addison's may have hypocalcemia due to poor diet and lack of appetite. They are expected to have hyponatremia and hyperkalemia as part of their labs. Hypokalemia, however, is related to Cushing's, not Addison's. A nurse cares for a patient with a head injury after a boating accident. The nurse knows that which of the following is an early sign of increased high CP? A. The patient has a seizure. B. The patient does not recognize a close family member. C. The patient vomits twice in an hour. D. The patient has a severe headache. The answer is B. The patient does not recognize a close family member. Vomiting, seizures, and severe headache are late signs. Altered level of consciousness is always an early sign and often the first. You are a nurse on a medical/surgical unit who is caring for a patient with Graves' disease. The patient has just returned from a thyroidectomy. Which of the following statements from the patient would require further assessment by the nurse? A. I have a headache. B. I hope I will be allowed to drink coffee now. C. My lips feel like they are tingling. D. My throat feels sore and my voice is hoarse. The answer is C. My lips feel like they are tingling. Tingling lips after a patient who received a thyroidectomy may indicate low calcium. During a thyroidectomy, it is possible to nick the parathyroid glands and have the parathyroid hormone production plummet, which will in turn fail to bring calcium out of the bones and into the bloodstream. A sore throat and hoarse voice are normal side effects. The nurse knows that care for a patient with Bell's palsy will include which of the following? A. Educate the patient that Bell's palsy is caused by damage to the fifth cranial nerve. B. Avoid stimulation of the patient's face. C. Apply an eye patch as needed. D. Report any increased lacrimation to the nurse. The answer is C. Apply an eye patch as needed. Bell's palsy, caused by the seventh cranial nerve, requires care to stimulate the facial muscle since the nerve cannot. An eye patch is needed to protect the eye because it cannot close even during sleep. Increased lacrimation is normal. A patient is brought to the ER by family members. The patient states that yesterday evening, she was having tingling and numbness in the toes of both feet. Today, she complains of bilateral muscle weakness in her legs. Which of the following pieces of information, if found in the patient's history, are most relevant to her condition? A. I exercise once per week on average. B. We are preparing for a trip to Thailand. C. I have a history of hypertension and diabetes. D. My mother died suddenly in the operating room. The answer is B. We are preparing for a trip to Thailand. Preparing for a trip to Thailand means receiving immunizations, which could trigger Guillain-Barré, the condition which is described in the question. When caring for a patient who experienced a head injury in a car accident, the nurse observes a bruised section behind the patient's ear. The nurse knows that this type of marking is known as A. Hohmann sign. B. Cohen sign. C. Chvostek's sign. D. Battle sign. The answer is D. Battle sign. Chvostek's is a spasm in the face that indicates low calcium. Cohen sign is non-existent. Hohmann sign is an indication of a DVT. Battle sign is due to head injury and internal bleeding. A patient with Addison's disease knows to eat foods that are high in sodium but are low in dash. A. Potassium. B. Sodium. C. Magnesium. D. Iodine. The answer is A. Potassium. Potassium. Patients with Addison's disease require a high protein, high carbohydrate, high sodium, low potassium diet. After a female patient has completed 6 months of multidisciplinary treatment for anorexia nervosa, the nurse evaluates whether the patient has met the goal of balanced nutrition sufficient to meet metabolic demands. Which of the following is the best indicator that the goal has been met? A. The patient no longer sees herself as fat or overweight. B. The patient eats well-balanced meals without former obsessive behaviors. C. The patient's menstrual period has returned and is regular. D. The patient's ideal body weight has been attained. The answer is C. The patient's menstrual period has returned and is regular. If a patient is meeting metabolic demands, her body will have enough calories/electrolytes to produce a period. If her body does not have the resources to spare, her period will not return. A patient begins hyperventilating due to a panic attack. The registered nurse knows that the correct intervention is to A. Call the physician. B. Have the patient breathe into a paper bag. C. Have the patient bear down. D. Put the patient on 2 liters of oxygen. The answer is B. Have the patient breathe into a paper bag. Paper bag is the best method because it allows the patient to breathe back in their own CO2 with less oxygen and correct the balance. A patient comes into the ER complaining of chest pain and shortness of breath. What action does the nurse perform first? A. Administer oxygen 2 liters by nasal cannula. B. Auscultate the patient's lungs. C. Administer a beta blocker. D. Administer nitroglycerin sublingually. The answer is A. Administer oxygen 2 liters by nasal cannula. ABCs. Give oxygen first. A homeless individual is brought to the emergency room after having been out in sub-freezing temperatures for 3 to 4 days. The toes of the patient's right foot appear hard and cold with mottling, and are unresponsive to touch. Which of the following would not be included in the initial management of this patient by the emergency room nurse? A. Rewarm the extremity with controlled and rapid rewarming until the injured part flushes. B. Wrap the affected extremity in a blanket and apply moist heat. C. Place sterile gauze between the affected digits. D. Elevate the affected extremity. The answer is B. Wrap the affected extremity in a blanket and apply moist heat. This patient is suffering from frostbite, due to prolonged exposure to sub-freezing temperatures without proper protection. Frostbite is a condition in which there is trauma to the tissues without actual freezing of tissue fluids. Exposed areas of the body such as hands, feet, earlobes, etc. are all subject to this. The affected part becomes hard, cold, and is not sensitive to touch, and mottled bluish-white in color. The aim of nursing care is to restore normal temperature and circulation to the part. All other choices would be included in the management of such a patient. Choice 2 is incorrect in that wrapping of the part could further constrict circulation. If blankets are used, it should be supported with a foot cradle and not in direct contact with the extremity. Prolonged applications of heat should also be avoided due to the patient's diminished sensitivity, and could result in a burn if not carefully monitored. An elderly client has sustained an intertrochanteric fracture of the hip and has just returned from surgery where a nail plate was inserted for internal fixation. The client has been instructed that she should not flex her hip. The best explanation of why this movement would be harmful is A. Displacement can occur with flexion. B. The soft tissue around the site will be damaged. C. It will be very painful for the client. D. It will pull the hip out of alignment. The answer is A. Displacement can occur with flexion. If the hip is flexed to the side, on the side of the bed or in a low chair, hip displacement can occur. Displacement could result in pain, but this is not the primary reason for the instructions. The remaining 2 answers are not specific or adequate explanations. Following a vasectomy, a patient notices discoloration of the scrotal area and becomes alarmed. In responding to the patient's concern, the nurse should A. Explain to the patient that this is a normal finding and usually responds to warm sitz baths. B. Note this is an abnormal finding and notify MD to see the patient. C. Know that this is not a likely occurrence, and is probably in the patient's imagination. D. Note that this is an indication of adequate blood flow to the area, and no intervention is necessary. The answer is A. Explain to the patient that this is a normal finding and usually responds to warm sitz baths. Abnormal discoloration of the scrotal area following vasectomy is not unusual, and usually responds well to warm sitz baths. The nurse should reassure the patient of such. However, ecchymosis, swelling, superficial wound infection of the vas deferens or epididymitis, or sperm granulomas, are all potentially serious complications, and the MD should be notified of any unusual findings immediately. Therefore, choices 2, 3, and 4 are incorrect. Following abdominal surgery, a client complaining of gas pains will have a rectal tube inserted. The client should be positioned on his A left side, semifallars; B right side, semifallars; C left side, recumbent; D left side, sims. The answer is C left side, recumbent. The left side position facilitates easy insertion of the rectal tube due to the anatomical position of the rectum. Recumbent position will be more comfortable for the client. A 21-year-old male has a confirmed diagnosis of a brain tumor. Following surgery for a tumor near the hypothalamus, the nursing assessment should include observing for A, inability to perceive sound; B, bradycardia; C, inability to regulate body temperature; D, visual disturbances. The answer is C, inability to regulate body temperature. The hypothalamus controls body temperature, fluid balance, particular emotions, such as pleasure and fear, sleep, and appetite. The visual area, 3, is controlled by the occipital lobe. The temporal lobe contains the auditory center, 4. Bradycardia, 2, can be caused by a problem in the medulla oblongata. After falling down the basement steps in his house, a client is brought to the emergency room. His physician confirms that his leg is fractured. Following application of a leg cast, the nurse will first check the client's toes for edema. B, change in color; C, movement; D, increase in temperature. The answer is B, change in color. A cast is rigid and used to maintain alignment. If it is too tight, it will press on blood vessels. The color of the toes will change first, then temperature, when blood supply is decreased. As the blood flow slows through the walls of the vessels, edema will occur. During the neonatal assessment, the nurse notes the baby has a cephalohematoma. Which type of delivery would be most likely to have caused this? A, NSVD; B, C-section; C, vacuum extraction; D, breech. The answer is C, vacuum extraction. Pressure on the head during this type of delivery will likely create a cephalohematoma. A client is admitted following an automobile accident in which he sustained a contusion. The nurse knows that the significance of a contusion is that A, laceration of the brain may occur; B, loss of consciousness may be transient; C, it is reversible; D, amnesia will occur. The answer is A, laceration of the brain may occur. Laceration, a more severe consequence of closed head injury, occurs as the brain tissue moves across the uneven base of the skull in a contusion. Contusion causes cerebral dysfunction which results in bruising of the brain. A concussion causes transient loss of consciousness and retrograde amnesia, and is generally reversible. A patient presents to the rheumatology clinic where a diagnosis of rheumatoid arthritis is made. Which of the following would not be an assessment finding by the nurse? A, presence of Heberden's nodes; B, warm, tender, painful joints; C, serum RF, and elevated ESR; D, PT, care of increased pain and stiffness in the morning. The answer is A, presence of Heberden's nodes. Rheumatoid arthritis is a chronic inflammatory connective tissue disease in which the synovial joints of the hands, wrist, knees, feet are usually affected. RA also has systemic effects as well. Choices 2, 3, and 4 are all potential assessment findings in a patient with this diagnosis. Heberden's nodes, however, are associated with osteoarthritis, and appear as bony nodules on distal finger joints. A client has sustained multiple injuries and fractures in a motor vehicle accident, MVA. During which period would the nurse be most vigilant in assessing for the development of a fat embolism? A, 72 to 96 hours after the MVA. B, during the first week after the MVA. C, during the first 24 to 48 hours after the MVA. D, during the second week after the MVA. The answer is C, during the first 24 to 48 hours after the MVA. Approximately 85% of cases of fat embolism occur within 48 hours of injury, making this the most critical time for monitoring the client for manifestations of this complication.